Hi class, welcome again to another session on biomaterials. Now that we have discussed various fixation devices such as the bone screws and bone plates, etc., let us move on to the replacement implants. So these are two very different things. So your fixation devices are usually used for long bone fracture, right? But joint replacement is prescribed for patients where the fracture incurred is in the articular surface of the joint. So it is either in the head of the long bone or in the cup of the other side. Like for example, if you take the hip joint, the fracture could be if there is a necessity for hip replacement, then the fracture occurs either at the head of the femur or at the acetabulum in the pelvis. So these are the two areas. If there is a fracture in either of these two areas, then you go for joint replacement surgery or hip replacement surgery. So one of the major risks of any joint replacement surgery is infection, because the nature of the surgery required for this type of fixation. You have lot of soft tissues. Any joint you take, whether it's a ball and socket joint or whether it's a hinge joint or bicondylar joint, any joint you take, alright, it is stabilized by quite a lot of soft tissues around it. So that these soft tissues can be ligaments, they can be tendons, or they can be muscles. So you have to pierce all the soft tissue in order to reach the bone, and then while you're operating, obviously there's going to be some soft tissue damage as well. So this the amount of depth that a surgeon needs to go in order to access the fracture and replace the fractured part with an implant is quite deep. The incision that is made is quite deep, therefore the risk of infection is very high. If for some reason the implant fails, suppose for some arbitrary reason the implant fails, then replacement of that implant, if the implant has failed, you don't want the implant to remain in the body. You want to take it out and try and replace it or with another substitute, right? So replacing for the second for a second time is very difficult, because large portion of the soft tissue would have already gotten damaged while you were implanting the first implant, right? So again you have to cut open the body and then take that implant out and then put another implant in. So that's going to damage quite a lot of soft tissues. So it is really very complicated. Therefore, if an orthopedic surgeon can fixate a fracture or can fixate a joint by salvaging whatever is there inside, then he or she would do that itself. They take a lot of scans, and before you're actually told that you have to have a hip replacement, all other possible options without the hip replacement surgery has to be negated first, and then finally the hip replacement surgery would be the last option. That's how the orthopedic surgeon they work. If by any chance they can fixate the fracture by whatever is there inside the body, then they'll do it. They'll salvage the joint as much as they can, right? So the commonly performed replacement surgeries are hip replacement, knee replacement, and elbow. So hip joint is a ball and socket joint, we all know this. Knee joint is a hinge joint, or to be very precise, it's a bicondylar joint, and elbow is a hinge joint, right? So we shall start off with hip replacement surgery. So earlier on, a diseased or a fractured hip replacement involved either the replacement of the acetabular cup, which is in the pelvis area, or the femoral head, right, the head of the femur. So either one of these two were replaced. So one technique of restoring the hip function was to replace the cup over the femoral head and let the body adjust, right? So femoral cup was placed on the a cup was placed over the femur head, and the acetabulum was resected to fit the cup. So it was it was dissected and it was reshaped to fit the cup. So it was assumed that the body, as time progresses, the implant would fit in, the body would mold around the implant, and then eventually adapt to the functioning of the joint. However, this was not a very successful approach, because the assumption that the body would ultimately adjust was not very good assumption, because some patients it adjusted, some patients it didn't adjust. So therefore the success rate of hip replacement surgeries was very low, right? But later on, as time progressed, as we made good progress in medicine, and biomedical engineering, we have now implants where both acetabulum and the heads can be replaced, right? So fixation of the implant, however, remains a major challenge in joint replacement surgeries, and this is due to the fact that the implant lies on the cancellous part of the bone. It is not on the hard periosteum part. So it is in between. After the periosteum, there's a spongy layer which is the cancellous bone. So this implant lies in the cancellous bone. So obviously the portion of the bone where the implant lies is very soft. So sharp edges of the implant can result in necrosis, which in turn would weaken the bone, right? So in order to overcome this fixation problem, first type of fixation method that was used was the acrylic bone cement. So this bone cement was prepared in the form of a dough. So there was a polymer powder and a monomer solution. Both were mixed together to form a dough, and then this dough was used along with the prosthesis, which was a hole was drilled in the bone. The prosthesis and the dough was fixed and tightly packed. So this dough, which also has the monomer, starts polymerization inside the body, right? And ultimately the entire material would polymerize and become very solid and fixate, like totally cement the bone into the cement the implant with the bone, and it will like become totally merged. So this cement was also used for fixation of acetabular cup. We shall discuss more of this bone cement in our subsequent videos, because I think I've run out of time in this one. I hope you had a fruitful session learning about introduction to joint replacement surgeries with me, or joint replacement implants with me. I shall see you again in another video soon. Please take care till then.